Good morning, everyone. Woohoo, it's Friday. Good morning. My name is Ashley Dietz. I'm the president and CEO of the Florida Philanthropic Network. For those who were not here yesterday, but I think most of you were here, hi, good morning. I'm also a proud board member of the Florida Civic Advance, and we are on day 2 of our summit. If you weren't here yesterday, just a couple of things. We have breakfast in the back. If you want to go get more coffee and food, please feel free to go and do so. And restrooms are on your right in that direction. We're going to kick things off. We have a lot to cover today. So it is my honor to introduce Dawn Hunter, who's going to be our first presenter this morning. And we have... You got? Cool. Okay. And it's just a reminder, it's also in your packet of what we have going on this morning, so lots to get through, but I would like to invite Dawn Hunter up for her presentation.
All right, good morning. And the clicker is working, or? Oh, yeah. Got it. Well, hello. I noticed this week I've said excited a lot, but it's true. This is one of the things I'm most excited to talk about. And I actually gave a presentation on the same topic yesterday, so I'm really grateful to be here with you all this morning and share some of the work that I do at the Network for Public Health Law. Very briefly, I joined the network in May of 2020, so right after COVID kind of hit. And one of the first things that I did at the network was write a law and policy issue brief on voting in the 2020 election and the implications of COVID. So since then, I've been able to build on that work, and it's really exciting. Do I have a timer also, by the way? Like, is somebody gonna hold up? Okay. So I do have a lot of information, and I'll try to go quickly through some of it. I also, before joining the network, was fortunate to work at the Foundation for Healthy St. Pete, where we are today, of course. And I, prior to that, worked in the health department of the state of New Mexico. I was the deputy state health official and director of health equity there. So the Network for Public Health Law is a national organization that provides legal technical assistance on a wide variety of topics. We predominantly do research and analysis and do consultation with people on different legal and policy issues in the field of public health. I mentioned a wide variety of issues. The issues I work on specifically on my team are racial health equity, civic health and well-being, and messaging for public health. So we do values-based messaging training. Oh, and here are some of the things that we provide legal technical assistance on. And I share this because I think people don't always know exactly what kinds of questions you can ask. You can ask us anything. And if we don't know the answer or it's not relevant to the expertise of our attorneys, we will direct you to someone who does have the answer. So as you can imagine, during COVID, we got a lot of questions about COVID emergency legal preparedness, but we also have a harm reduction legal project that we get a lot of requests around, as well as the other things here. So how many people are familiar with county health rankings and reports? Yeah, so it's great, and you can find Pinellas County, of course, and other counties in Florida. This was actually their national findings report from this year, which was focused on cultivating civic infrastructure and participation for healthier communities. I like this infographic that they do because these are all the things that shape how we experience life and our outcomes. And the other thing that I like to focus on is the participation piece. And what I'll talk about today is the role of law in increasing civic participation. In particular, what this findings report talks about is the role of women's suffrage, the Civil Rights Act, and the Voting Rights Act in reducing mortality rates for people of color and infant mortality rates in particular. So I start with this spot, which is that law creates the conditions for health. And one example that I like to give, that was actually on the previous slide, is the grocery store in the middle row. And the reason I start there is because I think people think about law sometimes and think of legislatures, right? Or think of the federal government, taking action. But law shapes every single thing that we experience. When you go into the grocery store, everything from the cost of your products to expiration dates to whether or not you can have a paper or plastic bag to the wages that employees earn to where the building is located to transportation options to get to the grocery store, law determines every single one of those things. And so I like to call attention to that because I think it's important that we understand how law shapes our lives so that we can have a more active and engaged role in the laws that govern our communities. So I like to share this. This is from the CDC's Morbidity and Mortality Weekly Report. This is the top 10 public health achievements of the 20th century. These are things that are probably familiar to people, but the reason I share this is because I like to ask, and I'll ask you now, and you can just kind of shout out, what do you think are some of the laws behind these achievements? And you can pick any one of them.
Requiring vaccination to be able to attend public school.
Yes, school vaccination requirements.
Safety belts for motor vehicle safety.
Yep, seatbelt laws. OSHA is one of my favorites. I joke sometimes, but I'm like, if you didn't die at work today, you can thank OSHA, right? Like, people were seriously maimed and injured and sometimes killed in the line of work, yeah. Mandatory reporting for infectious diseases, that's also a good one. Any other ones that come to mind? The ACA covers birth control, no copays, right? Yep, it's an essential service. Yes, advertising, tobacco advertising. In fact, these are just some of the laws, but the Master Settlement Agreement, which I usually have on here somewhere, yes, that is important because that is where tobacco companies had to pay up, and that's actually a major source of public health funding for health departments all across the country. Now, that doesn't mean they actually use it to fund public health. They have a lot of leeway in how that money gets used, and that's kind of, to me, a controversial point. But you see things like newborn screening requirements, and really, I like to, I work on racial health equity issues. Some of what we have around newborn screening is thanks to the work of the Black Panthers, who originally were interested in social justice. And they came out saying, we want our children to be healthy, we want to have healthy food in our communities, we want people to have access to health care. So part of why we have newborn screening is because we were seeing disparate outcomes in Black newborns, and there was a big push that ultimately led to kind of the current laws that we have today. So I'm not going to read all of this, but I'd like to share this because people have heard of the social determinants of health. I know that's a kind of public health buzz term, but I want to, again, reinforce the idea that law shapes our lives. So at the top is the idea of law as a set of requirements, right? Laws, things that we think of as laws, ordinances, regulations, statutes. But it's also policies and procedures. It's budgets. Budgets are created in law. Those are an important policy tool. I like number 3 to point out. It's a set of norms and expectations. That's really important because, especially at the organizational level, how organizations behave drives everything that those organizations interact with. And then, of course, it's our individual rights and obligations. So the other question I like to answer is, why am I here as a public health lawyer talking about voting? This is not something that's very common in my field in particular. This is actually an article from colleagues of mine at the University of Wisconsin Population Health Institute, and I like to read the quote because I think it's really important and also is related to other work that I do. As many places in the US have declared racism a public health crisis, the erosion of voting rights must be understood as manifestations of structural and cultural racism and thus prioritized for action. When democracy is weakened, social cohesion and public health suffer. So I have done an extensive amount of work on reviewing and analyzing declarations of racism as a public health crisis across the US. This particular report is from one of my partners in the Collaborative for Anti-Racism and Equity at the Institute for Healing, Justice, and Equity at St. Louis University. And what I like to point out here is that taking a public health approach means recognizing it affects large numbers of people over time, and that policy and system change are required over individual interventions. So this is what distinguishes us from healthcare. This is a map as of December 2021 numbers. These haven't shifted a whole lot, so maybe in 2022, I think we had fewer than 40 new declarations issued. And of course, Florida, we have 3, including here in St. Petersburg. A colleague of mine and I analyzed 211 of the declarations, and we just looked at the resolve section, which is what we're actually going to do about this now that we've said it's a problem. And we also Well, and this is actually from the whereas section, so let me go back. So we did do that, and we looked at the preamble statements to see what were they talking about. These were the 3 common threads that we found in the declarations. So things that we probably know, but I think it's important to call out because the work of Dr. Kamara Jones, one of the things that we do is have to acknowledge history in order to rectify it. So racism affects lifelong health outcomes, even before birth and across every single stage of life, across generations. Racism significantly reduces life expectancy and increases premature mortality, and unequal access to opportunity affects economic stability, home ownership, and intergenerational wealth accumulation.
Could you go back one slide?
Yeah.
I was paying attention to the Northeast, the 32 and the 27.
Yeah.
Why so much in those moments?
Yeah, that's a great question. Massachusetts, I think, in particular, is a state where enslaved people have a deep history, and in terms of the slave trade, there are a lot of cities and counties in Massachusetts that contributed to that. And so, in particular, in that state, I think a lot of the declarations comment on that history. Connecticut had a local nonprofit, I believe, develop a template. And ultimately, that template was adopted by a large number of cities and counties there. That's actually also the case in Wisconsin. So Wisconsin has 6 on this map, but what they did is the Wisconsin Public Health Association issued a statement, and when I first saw it, I think they had over 45 different city, county health departments and health systems sign on to it. So it says they have 6, but they actually effectively had a lot more because a lot of people signed on to this statement from the Wisconsin Public Health Association. And templates were common in other communities across the country as well. So the next thing I like to talk about is how law is a tool for equity, and this is like kind of getting into the meat of it. And how many people have heard the phrase equity lens? How many people feel like they could define it for like somebody sitting next to them on an airplane that you've never met before? It's harder to think about how to explain it, and myself included, so I spent some time looking for a definition that resonated with me. This is the one that I really like: strategically, intentionally, and holistically examining the impact of an issue, policy, or proposed solution on underserved and historically marginalized communities and population subgroups. This is another attorney that I have the fortune to work with, Megan Douglas. She's at Morehouse School of Medicine, Satcher Health Leadership Institute. And it's really important to think about applying this, looking at the way things are done, what the outcomes are, and what the values are that inform that. And then typically this is guided by a set of reflexive questions. I don't have that up here today, but these are questions like, who's at the decision-making table? What data do we have, et cetera. So we're gonna apply this to a topic that I have already mentioned, which is infant mortality. And I like to use this to illustrate the role of law and then connect that to why it's important to vote. So this is actually an older set of data showing 2017, 2018. Unfortunately for the US, these disparities haven't changed. So you can see the taller bars are for Black and American Indian and Alaska Native infants have significantly higher rates than any other population group. And it's important to note that because our policy actions or inaction is why we continue to have such disparities. And so one of the things that I do is research. And so we've looked into what makes a difference in infant mortality rates from a legal perspective. These are all the kinds of laws that reduce infant mortality rates. Civil rights laws, and I'm going to show you a graph from the top article momentarily. Minimum wage laws, so increase in minimum wage is associated with lower infant mortality rates. Public health laws like mortality review committees, it's important to understand why infants are dying in order to be able to address the cause. Medicaid expansion, ample evidence that Medicaid expansion works. This is not a debate. It has literally saved lives. And then education and training requirements. And you will have access to these so you can have access to these references. And by education and training requirements, I mean things like cultural competency training and implicit bias training. So this is from the top article that I mentioned. This shows the middle line on this graph is 1965. So after the Civil Rights Act of 1964 was passed, we saw a significant, so the top 2 lines are Black urban and rural infants, and the bottom 2 lines are white urban and rural infants. And what I hope you see is a decrease in infant mortality over time and also a closing of the disparity gap. So the civil rights era was really important for improvements in health outcomes for all Black Americans, but in particular for infant mortality. The next time we see significant reductions like this is with ACA, Obamacare. So the other thing that I like to do is connect everything to history. So again, it's important that we acknowledge why the problem exists in order to rectify it. So how many people have heard of the Flexner Report of 1910? Okay, this is awesome. So the Flexner Report was a report commissioned by the American Medical Association to inform the accreditation of medical schools. And what that ultimately resulted in was the closure of most Black medical schools that existed at that time. So the reference on the left is actually analysis that was done of how many Black physicians we would have in the workforce today if not for the closure of those medical schools. And they estimated 27 to 35,000 fewer Black physicians in the workforce today because of something that happened in 1910. What does that mean? That means people can often have a worse experience of care. There's ample evidence to show that people's outcomes depend on having a relationship with their provider that matters, that people who understand them and speak their language and understand their culture. So at the end, higher infant mortality. Why do I include this? This is actually a study of 1.8 million births here in the state of Florida over a 23-year period that showed that Black babies are more likely to survive when they are cared for by Black doctors, and they're more likely to die when cared for by white doctors. And that's a pretty significant data set. This is important because we have to understand that decisions that are made have ramifications, and they often play out over a long period of time. So it's important to think at a structural level about how we fix that. So now I'm going to talk about kind of the relationship between all the things I've been talking about, law and voting and health. So I'm going to ask you all, what health outcomes do you think are linked to voter turnout? And I would say there are no wrong answers. There may be wrong answers, but anything can be suggested. Mental health is absolutely on the list, yes. Healthcare access. Gun, I'm not sure if there is research, which isn't to say that there isn't some. I'm not sure if there's a direct connection, but that would be, yeah, interpersonal violence. I will show you the list. So we did a lit review. At the top of the list is self-rated health and mental health. So these are people who may be familiar with the behavioral risk factor surveillance system. You rate your health relative to your peers or in your age group or relative to another point in time. This is actually something that is done not just in the US, but across the world. And in fact, one important piece of research that we have is from the World Values Survey that 44 countries participate in. It showed that in countries that have better voting turnout, they also have better self-rated health in their population. All these other things are also on the list, things that you might expect, like income and education level, but also your disability status and chronic disease prevalence. So the research in a nutshell tells us this, that we have kind of a reinforcing feedback loop, that when people are more engaged in the civic process, that can result in more inclusive health policy through increasing power, increasing access, and increasing social cohesion. There's a lot more research needed to establish kind of causal links, but we have some preliminary work around this that suggests that this is one of the mechanisms, and that leads to better health outcomes. And we know that when people have better health, they are more likely to vote. So it reinforces. But the reverse of this is also true. So if you don't vote, often it's because you don't have good health, which means we have less inclusive health policy because your voice is not represented. I sometimes use the example of Medicaid expansion, right? If you have always had employer-provided health insurance, if you've never gone without insurance, or if you had an income where you haven't had to struggle, you may not go to the ballot thinking about the importance of Medicaid expansion. It just might be something that's foreign to you. Doesn't mean that you wouldn't support it, you just don't understand the need for it, and maybe you don't even know nobody who's covered by Medicaid. So it's important to think about what we mean by inclusive health policy. So one of the things that I did is work with Dr. Scott Schroffnagel and his team at Northern Illinois University. This is published in the Election Law Journal. This is called the Cost of Voting Index. The work that I am about to show you is using the 2020 version, although it has been updated for 2022. And what you see basically is the lowest cost of voting, and what we mean by that is it's easiest to vote in those states, or access is less restricted. And then at the bottom is the worst. So at the top is Oregon and Washington, at the bottom is Tennessee and New Hampshire. New Hampshire is an outlier. I'll talk a little bit more about that in a moment. So the index includes kind of two buckets, which is being able to register to vote and then being able to cast your ballot. So things that you might think about, like pre-registration laws, so being able to register before you are 18, automatic voter registration, we do a lot of work around that. A presentation I gave yesterday, we talked about Medicaid-based automatic voter registration, which 10 states are currently trying to implement. And then casting your ballot, so things like poll hours and early voting options. This is all, so you're getting the short version of this, but we spent 6 months working on how to tell the story of what we were seeing in the research and the data. And ultimately, it was published as the Health and Democracy Index. It's democracyindex.hdhp.us. This was done in partnership with Healthy Democracy, Healthy People. It was supported by the Center for Secure and Modern Elections and the Center for Civic Design. And basically what it is a way to visualize this relationship between health and voting that I have been talking about. And the bottom line is that states that have better voting access and greater civic participation are healthier. So we just this past week updated the data. So on the left is what we published in 2021 on this website, and on the right is 2023. When you land on this, this is the homepage. What you see is the cost of voting index on the x-axis and health outcomes, and that's based on America's Health Rankings overall health for each state on the y-axis. And what I hope you see is a very clear linear relationship between the cost of voting and health. So states in the upper right quadrant have both better voting access and better health. Florida is circled in red. It's not the worst, though. It's not the worst. I mean, you see Mississippi over here. Louisiana is another outlier, and I'll talk about that one in a moment. One of the cool features of this is that we want to tie it to law. And so there are 4 categories of voting policies that you can pick through on this website. Inclusive registration, so these are things like automatic same-day and election day registration options. Vote at home, so this is typically all mail elections and no excuse absentee voting. Restricted voter ID, so laws where you have to establish, you have to provide additional proof of eligibility to vote after you've already established your eligibility to vote. And then voting rights restoration, which is what is pictured. This is something I'm personally very passionate about. We have a Florida Rights Restoration Coalition here doing really good work to address the problem here in Florida. But what you can see, and to me it's just really astonishing, states that where you either never lose the right to vote or your rights are restored post-incarceration have better health. There are 2 states and 1 jurisdiction that you never lose the right to vote. Does anyone know what they are? Vermont is 1. Maine, Washington, D.C. So why is that important? Just because you're incarcerated doesn't mean like you don't have children who might be going to school, and so you want to know who's on your school board. You're going to need a job when you get out. You're going to need health insurance. Shouldn't you be able to decide all those things? So it's important to understand the impact of law. This is from 2022 from the Voting Rights Lab, a partner of ours. Governor Reynolds tried to work with the legislature to get rights restoration passed. They didn't want to do it, so she issued an executive order. Of 4,000 Iowans who had their voting rights restored after felony convictions and then re-registered to vote in the 2020 election, 77%, or nearly 4 out of every 5, cast their ballots. It's pretty significant, especially in locations where you have lower voter turnout. It matters. People want to vote. Why are we making it so hard? This is just in the last few years of what's going on with rights restoration. According to the Sentencing Project, which is a great resource if you're not familiar with it, 4.6 million people were disenfranchised in the US in 2022. Florida's at the top of the list in terms of disenfranchising voters. These are just some examples. One I will call attention to is Virginia. So in Virginia, Governor Northam took action. So he didn't issue an executive order. He just changed an administrative process through his authority as governor, resulting in rights restoration to about 69,000 voters. Governor Youngkin, the current governor, has scaled back that process, and only about 4,000 people have been able to get their rights restored since. So one question I like to ask people is, what do you think affects both voter turnout and health outcomes? So this, as an example, transportation. Affects your ability to get health care, but also affects your ability to vote. What are some other things? Housing, yeah. People who who move more frequently tend to either not be on the voter rolls or vote less frequently. And also, it determines whether or not you can vote, or where you can vote. It also determines the health conditions that in the housing itself, in your community as well. Income, yep, absolutely. How much money you have totally determines both of those things. People who have more money vote at higher rates, and people who have more money have better health outcomes. Connection. Education, same pattern as for income, yep. Basically the social determinants, yes, yes. Yeah, employer flexibility, right? So that's an access issue. So whether or not you are able to take time off of work, or you have sick leave, you get paid to go vote. My organization pays us to go vote. And when I worked at the health department also gave us time off to vote. So I share that because it's important to understand that disparities in voting and disparities in health are linked. This is from the US Elections Project, and it shows non-Hispanic white is blue at the top, and then Hispanic green at the bottom. But basically, you can see the spread that white voters vote at higher rates than other population groups. This has not changed significantly over time. The peaks are because of general election and presidential election years and midterm election years. So we have done some research, again, some additional research that I'm going to talk about and just give you like the high-level findings. But the question is that our research question was, when citizens are more involved in their communities, through voting, volunteering, or other forms of civic participation, do these individuals in the states they reside in experience better health outcomes? Well, the answer to that is yes. This goes back to 1996. So Dr. Schroffnagel and his team looked at all general elections going back to 96, presidential elections, and these are all statistically significant, showing that an increase in the cost of voting is associated with a decrease in overall health. In other words, something I've already told you, if it's harder to vote, overall public health outcomes are worse. Same thing is true at the individual level, and I was told I have 5 minutes, so I'm not going to read these, you'll have this, but all the things I've just been saying just reinforced on one slide, with disparate outcomes for people with lower education level, lower incomes, people over 65, and Black and Hispanic Americans. Coming back to the differences in New Hampshire and Louisiana, we wanted to know why. One of the things that I put forward as a possibility is the percent Black population in those states. So New Hampshire has one of the lowest Black populations, and Louisiana has one of the highest Black populations. Well, we have found that the only thing more strongly associated with health outcomes than the cost of voting index is the percent of Black population in a state, and that's what you see here. And this just is the same information in new graphs. We're about to submit this for publication, showing that whether you look at it from a positive health perspective or a negative health perspective, that where it's harder to vote, people have worse health. And part of that is because of representation gaps, especially in states that have a higher Black population. And the one thing I do like to point out is that it's not because of individual behavior choice. We have a cognitive bias toward seeking out information that reinforces stereotypes that we may have about people. So it's easy to look at this and say, well, that's just because Black people choose not to vote or other people of color choose not to vote. That's not true. It's because these are states that have entrenched structural barriers: failure to address redlining, unequal wages, failure to expand Medicaid like here in Florida, and voter suppression. And this is just showing you infant mortality. To go back to my very first example, what you see is all population groups at the top in blue and just Black or African American in orange. And what you see is that states, again, infant mortality is lowest in states that have better voting access. So I will not go into detail on this, but the bottom line about Medicaid expansion is that there's plenty of research that shows that it works. It increases voter turnout and reduces disparities. And that when people are healthier, they're more engaged. And that matters for us both as individuals, we are healthier, but also our communities are healthier. This is just an image from Center for Budget on Policy Priorities showing how many lives were literally saved by Medicaid expansion. And then this is an older graph, but it shows the states, including Florida, that have not expanded Medicaid, with the note that Missouri, North Carolina, Oklahoma, and South Dakota have since adopted Medicaid expansion. So we're definitely not on the wrong side of the trends here in Florida, and so hopefully we can kind of mobilize around that. These are just a map of the current expansion states. One thing that's significant in Florida that I will point out is that postpartum Medicaid coverage. So traditionally, Medicaid had covered up to 60 days postpartum. States have been moving to expand that up to a year because maternal mortality is measured by, or infant mortality is measured, and maternal mortality within the first year post-birth. And so 5 years ago, this map did not look like this. States were really resistant to extending this coverage. But now you can see most states have some form of coverage, including Florida, and Florida was adopted in a budget bill. So it wasn't even like this big push to address disparities. It was like, we recognize that this is something that should happen, we're gonna put money toward it, and it happened. So I'm wrapping up here, so do I have like 2 minutes? Yeah, you have a question. Okay. I've written about this. You'll see St. Petersburg on the list. There are 10 jurisdictions I found that specifically mention either voting or civic engagement in declarations of racism as a public health crisis. This is important because then you can leverage that to say, this is why we are taking action on voting and civic engagement in our community. I worked with partners at Healthy Democracy, Healthy People to get this policy passed by the American Public Health Association on Election Day last year, which was really exciting. But this is advancing health equity through protecting and promoting access to voting. It's great. It has lots of recommendations for action steps that you can take. And it's important for health departments to have that kind of guidance from our largest public health organization. And then I like to talk about the power of partnership. So I don't know how many people know that Healthy People 2030 actually included voting turnout as a measure. 2020 had it as a measure. And under the Trump administration, it was not included in Healthy People 2030. The group that I work with advocated to get it included. It was restored to Healthy People 2030. It was elevated to a research objective thanks to advocacy on the part of our partners, and then recently was elevated to a core objective, which is the strongest objective it can be in the framework. So we're very excited. That was like a 2-year process for that to happen. And this is also important for health departments to be able to say, like, we have the ability to engage in this work, and here's how it's tied to the work that we do as public health professionals. And this is it. Take action. Register to vote. Vote local. Get involved in your community. These are all things that are good for you and good for your community, good for your family. As organizations, you have to make sure that you support civic engagement, so we heard that, right? Time off to vote, getting leave to serve as a poll worker, host town halls and other community sessions where you get to engage with elected officials and candidates across the political spectrum. It's important to provide space for diverse perspectives, engage in nonpartisan voter education and voter registration efforts. League of Women Voters also, I have Vote 411 up here, but League of Women Voters. And if you can't do any of these things directly, you can be a good partner. You can help support organizations that are able to do this work directly. And then incorporate civic health strategies into your community engagement process, whatever that looks like. So I'm happy to answer questions about this work. I do post a lot of racial health equity and civic engagement stuff on LinkedIn, so please feel free to connect with me there.
Hey, Dawn. You connected voter, which is one of the things that you connected voter and health outcomes. Are there other components of civic health or civic engagement, things like volunteering and all that kind of stuff, that there is health impact from? Is there research around that as well?
Yeah, in fact, some of the key studies that support the voting turnout piece also support the community engagement aspect. Volunteering in particular, involvement in community groups is associated with better health outcomes. The one thing that has kind of the reverse relationship is like political activism, which is a form of civic engagement, but it doesn't have the same association necessarily.
You mentioned Governor Youngkin and what Governor Norton had
Northam,
done.
yeah.
Did Governor Youngkin completely obliterate everything that the previous governor did? Because you mentioned it was like 20,000 people got to vote, and then it was 4,000. So those were people disenfranchised after they had gotten franchised, or just there was only 4,000 additional voters?
Only 4,000 additional under the current governor. So from what I can tell, I couldn't find an executive order that he's issued. I think he's just taken the process under the previous governor and just changed some of the steps to make it harder for people. And then also does, like here in Florida, one of the things that happens is like the clemency board doesn't meet. Well, that's a process issue. If you never meet to talk about whether people can have their rights restored, then they'll never get their rights restored, right? So when you make the process harder, that also effectively just continues to disenfranchise people. Is any of this, was this new to people, like the relationship, or have you heard it before? New? You've seen it? Thanks. Well, I'm always happy to answer questions, share research, talk a little bit more. We will be launching a campaign as in partnership across 11 different organizations. We will vote in 2024. Really a partnership between the healthcare and public health sectors to get out the vote. One partner I will also mention is I work in public health, but I do a lot of work with Vote ER, which does healthcare-based voter registration. So you can actually, if you're a healthcare provider, you get lanyards with a QR code, and your patients can scan to register to vote at the point of service, because that is part of having healthier patients. Oh, I thought you were going to say something. Yeah, yeah. Okay. Thank you for your time.